I'd now like to introduce FADA Policy Analyst Seth Embry, who will discuss today's agenda.
Good afternoon, everybody. So Blake has already discussed the panelists, and so following their presentations in which they'll discuss what's going on, well, in the case of John and David, they'll discuss what's going on at their agencies and how they're using the funding. Crystal will discuss some background on the CARES Act and some of the things that she's learned in speaking with agencies. Following those presentations, we'll have a discussion with the panelists of some of the questions that have been submitted already and some of the questions that we've come up with to have a discussion, and then we'll open this up for questions from you all. Blake has already discussed. Please use the Q&A feature and not the chat feature to post your questions, and we'll go through that. Additionally, some of those questions will be answered in the Q&A box, and some of them will be answered live depending on the type of question, and we'll talk more about that and get more into that as we continue. So with that said, we're just going to go ahead and start with Crystal and her presentation.
Sure. Good afternoon. I'm Crystal Wojciechowski. I'm going to share my screen so we can start a few slides. There we go. So again, Crystal Wojciechowski, I'm a policy analyst at FADA, been with FADA since 2014. I'm going to start with a little bit of CARES Act background, and then why we essentially put together this webinar for you today. So shortly following when the CARES Act was signed into law on March 27th, we started to get lots of questions and concerns from agencies about the additional supplemental appropriations and how best to utilize those funds, and innovations that possibly PHAs across the country had been strategies and innovations that public housing authorities across the country had been using as best practices, so that agencies who might have might be trying to figure out how to best use those funds. So a few months ago, right around April, we started to communicate with executive directors across the country to see what were the adverse impacts that they foresee coming up through COVID-19. So one of our articles, and just one thing to note, at following this, there is a few slides with lots of links about all the articles and the analyses that myself, Seth, David, and Arlene, Jim, everyone across the board have been put into the advocate so that you can actually refer to those if you have questions. So after we had started to determine what the potential adverse impacts were, we started to talk directly with agencies to see how they were spending their money. So the CARES Act, like I said, signed into law on March 27th. There was $685 million for the Public Housing Operating Fund, and then $380 million for the Housing Choice Voucher admin fees. A few things to note, and we'll talk about this a lot throughout the presentation, is that funds must be expended by the end of 2020, unless this is extended by Congress, or else they will be recaptured. So it is so important, and why we're here today, to help you determine what's the best strategy for your agency to spend those funds so that they will not be recaptured. The expenses should be tracked carefully, and we discussed this a lot last week in our webinar on accounting and tracking. There is not a lot of guidance right now related to that, but questions related to how to track, go back to watch that webinar, but ultimately they can be tracked just like any other operating or admin fees. That would be the best route to take this time. So some things to keep aware. So as you question what you may want to spend your funds on, either the public housing or housing choice voucher, there are some really great notices. PIH notice to 2020-07 for public housing, and then 2020-08 for housing choice voucher. And these notices and the FAQs reiterate that these funds are supplemental operating funds that you can use to maintain normal operations and also to prevent, prepare for, and respond to the coronavirus. In addition, they can be used for any capital fund eligible activity. And then also the FAQs and the notice provide additional examples of how to use them to prevent, to prepare, or to respond to coronavirus. For the admin fees, again, they can be used for any currently eligible Housing Choice Voucher admin fee cost during the period that your program was impacted by the virus. And then also some other related activities that either support your residents, their health and safety, or also retain and support participating owners. PIH Notice 2020-08 does list out about 8 specific examples of permissible coronavirus-related expenses. The one difference with the admin fees is that you must use, if not for normal operating expenses or eligible administrative cost, you must use the funds for those 8 activities or request for permission or approval. And those are actually detailed in the notice, and there is a link to that notice at the end of this presentation. So there is some information in an article back in April about what PHAs had been using their money for. And I will go through a few of these. We don't have much time, so I may move a little quickly, but we will answer all of your questions in Q&A. So the primary expense that PHAs had been using were to maintain normal operations in public housing and the voucher program. So if you have a question about what you should use your money for, spend it first to maintain normal operations. I would say that would be the biggest takeaway from my presentation today. But in addition, agencies used it most often for personal protective equipment like masks and gloves, hand sanitizer and disinfectant, equipment to assist in cleaning common areas like floor scrubbers and foggers, also to pay for professional office cleaning and sanitization if the agency felt more comfortable doing that. In many of the hard-hit areas, agencies paid for the cost and the delivery of food and other essential items. We saw this a lot in New Jersey and also in New York. In addition, payroll. Some of the more innovative things that I noticed was thermal equipment in lots of different ways, either contactless thermometers or even equipment that would verify someone's temperature when they checked into the office. Some agencies like DC are using virtual inspection equipment to eliminate their maintenance teams' need to have to go into units to get into contact with residents. Lots of agencies used these fees to update their IT, both software and hardware, so that staff could work from home and then participate in virtual meetings. Also communicate better with the residents virtually. So router upgrades, virtual meeting platform costs. We often heard material and labor costs related to redesigning an office space so that in an event that staff needed to see clients face-to-face, they could be maintaining social distancing, also putting up barriers and separation between staff and tenants, particularly in areas with elderly populations, because many of the elderly preferred to come into the office because they just did not feel comfortable using IT. So new office entrances like buzzers and intercom systems so that PHAs could maintain the number of people in their offices. Lots of other relocations of laundry rooms, installation of kiosks. Agencies across the country really had some great strategies for how best to use their funds. So this will be available to you. So if you have any questions about any of these, please let us know. So my experience working for housing authorities was primarily from a small agency's perspective. So I quickly wanted to talk a bit about that. So when we first, back in April, when FADA started analyzing everything that was happening and we were looking at FAQs, the impacts were really unknown back in March. They still, I believe, from a small agency's perspective, are still unknown because it's only been a few months. And I think that if your agency has questions about guidance and how to spend these funds, that you should just keep it simple. You're already tracking and managing expenses that to maintain normal operations. From what we've seen in the guidance, that an agency, particularly a small agency, the reporting that you're already doing for these funds, it should be similar. If you're maintaining and tracking the invoices and the money that goes from locks and then out to pay those expenses, you should have everything that you need to report to HUD. And to really, I think John Mahon, when I talked with him months ago, the priority for him, and I do not want to speak for him, but was to make sure that his residents and his staff were safe. And I think so long as you're keeping it simple and prioritizing your staff and your residents, that you will ultimately easily be able to spend the supplemental appropriations. And just a final thought is to make sure that you spend this money first before anything else, so that we don't run into a problem at the end of the year where there is money left, or else it will be recaptured. So these are a few slides of the resources that we have. And they link to all of these documents. So feel free to jump into those if you have any questions. And I am going to drop it off to David Northern. He's going to talk what his strategies at his agency in Champaign County, Illinois. So David Northern, take it away. Thank you.
Thank you so much, Crystal. I appreciate that. You know, first of all, again, hope everybody's having a good day. It's been a really trying time for all us leaders in the housing industry in order to ensure that our clients stay well along with our staff. So I'm David Northern. I'm the CEO of the Champaign County Housing Authority in Illinois. We're an MTW agency. So I'm thankful to have that, been afforded that flexibility ahead of time related to a lot of challenges that we're facing. I'm also the Senior Vice President of FADA. Our agency is, we serve around 3,000 clients, but we're focused more so on we're 100% RAD. Also, I mentioned we MTW, we just received a youth bill grant. So we're working trying to just partner our organization overall to try to change the lives of the clients that we're serving within our community. We have close to $120 million of development going on right now, 9 different developments. That's happening: low-income housing tax credit, 4%, 9%, along with permanent supportive housing. And we're kind of really moving away from the traditional public housing authority. We're more like an affordable housing developer, like most of you guys are. So we have about 5 developments outside of our county. So we're doing a lot of rural development and developments in other areas to help supplement the income or the disinvestment of federal funding from the Department of Housing and Urban Development. So related to COVID, it's just a tough time. I've been hit personally pretty hard, but also, you know, our staff members, our community here in Illinois, we're doing a pretty good job in accounting related to working it together. But from the start, early March, we started planning. We shut the office down, the cleaning, and Crystal talked a little bit about some of the uses, and we've used a lot of our money in a number of ways. We pay a different accelerated rate for individuals that had to, that was required in terms of essential to come in and out of the office constantly, or working in maintenance. Maintenance, we have 3 different levels. We have maintenance, they get 10% of their salary per month, additional 10% per month. Then the office kind of staff, I think they get 8%. And then if people aren't coming in, they don't receive any differential pay related to that. The cleaning costs associated with keeping our buildings, being RAD is nice because we had most of all our buildings upgraded, or we have brand new properties that we're working with. However, we're dealing with, you know, some of the most vulnerable clients. And so we had a lot of cleaning, a lot of upgrades related to that. And so we're using that money in order to help. We have a minority cleaning company, and it's pretty, you know, pretty well put together. They hired a number of our clients, and so that makes it even better. They're going in and you know, doing like the mist spray in our office like weekly to ensure that individuals coming in and out. We aren't seeing clients. We're doing virtual briefings. We had been able to increase our lease up, so that was one of the things I really want to focus on. You know, when I sat down with my team, I decided, hey, let's look at what we can do in order to improve our organization. What ways we can improve our organization and take advantage of this situation. And so we looked at you know, lease ups. We came up with a special preference. We call it it was the temporary COVID stay-at-home voucher preference. So we, in terms of working with individuals throughout the county on a COVID response team, we found that there was a barrier that we were having with individuals homeless in the shelters. So there was a lot of people going to the shelters. There was a lot of domestic violence going on. And so we came up with this preference to allow individuals, if you spent 2 weeks in a shelter, you can go right to the top of our waiting list and we get you housing, right? So we can open up the shelters, we can keep people safe and clean, and we also can, open up the shelters so more people can come in. So that was very helpful in our community. We set aside 50 vouchers or project-based vouchers or RAD units. We talked to our other developers also and partners in order for them to get on board. Another thing we did is that, we decided to utilize the waivers. So we had the board approve access and opportunity for us to utilize the full ability of our waivers. And just recently, we eliminated criminal background checks. Other than, we eliminated everything but the HUD mandatory screening for housing, right? So we got rid of all that 3-year wait after this and after that type thing. We just want to really focus. With the civil unrest happening with COVID, us moving in the direction of, helping people overcome obstacles. So we decided that we did something a little different. And so we, stood up on our merit. And we decided to get rid of the criminal background checks other than the mandatory lifetime sex offender and methamphetamines producing. We have 3 different reentry programs right now at our housing authority, and they came about during this crisis. We have a women's program, a men's program, and we have some funding from the Illinois Development Housing Authority. They have a reentry program that we partner with the Department of Corrections. It's a state funded, so they're paying for vouchers for individuals. And with Youth Build, we have so many people overcoming obstacles. Why do criminal background checks again, right? We looked at the statistics and data around that. We're currently revamping our office. I really kind of like the Zoom. The Zoom meetings now, we're able to communicate. It's good to be able to see people when you're talking to them versus just on the phone. So we've hosted meetings constantly with the staff members, the community. Our agency has been doing panel discussions around COVID, the civil unrest and things like that. Also, staff has been a presenter on it. A few weeks, a number of other housing providers have been on our panel discussions that we've hosted. It's called the balcony and the dance floor. We're just looking at different ways to continually communicate, share the wealth and information. As far as our vehicles, most of the car wash places, I know some people don't even think about the vehicles, but your staff getting in and out of vehicles, constantly going in and out of units for emergencies. We have to make sure that, we keep our vehicles clean, safe, and sanitary also. And so we contracted with a local car wash that's going in. Most cases, they're not really washing our vehicles and going inside your vehicles, but this car wash is doing that. And they're using the mist spray to keep our employees safe as they exit and enter those vehicles. It's just it's a host of things. Our board members have been great. Our community members have been great in terms of coming together. Every time we talk to another housing authority or another housing authority's staff, we find different ways that we can improve and ensure that our clients getting the best possible resource and utilizing that money. So we've been utilizing the money at a great deal, and we're going to continue to do that. We decided we're working on our opening plan now, especially with the civil unrest, all the rioting and looting and protesting that's been going on. It's trying times, and so we decided to push back our opening. So we have essential staff still working in the office, but we plan to open back up in terms of every staff member coming back around September. We want to wait for this curve to hit. We know it's coming and it's possible. As I said before, that I've been fortunate that to be healthy, but my family has been hit pretty hard. Both my kids tested positive, and my daughter just got out the hospital. And leaving the hospital, the lines that was at the door coming in from the second wave that's happening here in Illinois was kind of enlightening to show, to say the least. So I know that as we continually prepare to start our normal life again and get back into the office, we're looking at every way that we can in order to make it safe. And we're utilizing that money. We shut some of our bathrooms down in our office so we can maintain, the cleaning of restrooms. We haven't had a regular client into our offices probably since early March, and we don't plan on having any clients in if we can help that. We had to we got a youth bill grant in January. So we was able to start a program, and it has been helpful to have some of the funding. We added youth bill to our resources in terms of programs that the agency has, and working with our young people. And so we've been having the young people go out and do community events, and we fed we fed the fathers for Father's Day, and so we used some of the money, utilizing some resources for that. We partnered with some of the community organizations, and they gave all our senior clients, if they signed up, they gave them 6 masks, 6 meals, Lysol. So our youth bill program, we went out and delivered that. We partnered with our local hospital. And that's one thing you got to really utilize, your partnerships in the community. We have a major university here that's doing a great job in terms of University of Illinois. They've been partnering with us. Carl Hospital, they gave us close to 3,000 masks. So we constantly, I ride around in my vehicle with masks. If I see people without masks or without cleaning supplies, we try to provide it. So we've been able to use our money, but we also been having a number of great partners, because not just the housing authorities receive money, other different areas receive money, and they're willing to help our clients. We all serve the same clients, right? So we want to focus and continually work as one agency, one voice in a sense. But ensure our clients are healthy. Thankfully, we haven't had to shut down any buildings. We haven't had any major crisis related to that. In housing, we always have bed bugs. So, we've had to deal with bed bugs during this crisis, which makes it even a little more challenging. But overall, we've been great. The mental health, we've brought a number of speakers in to talk with our staff on Zoom, or even clients. We offered the opportunity for our clients to get some mental health prevention, because this is trying time. With COVID and the civil unrest, it's really tough right now. And so we've been able to stay above water, utilizing our funding, our various resources. FADA's been a great help. Anytime I had a question, I reached out to FADA. They've been able to answer it and work with us, so that we can, stay up to date on what's available, what we can utilize, and just, sharing it with us, as I mentioned earlier, and seeing what others do. I know one of the housing authorities that was on our panel, they developed an app. And that app, they're using the app. They get an app to their clients, and they're using that app to keep people informed about where they can get supplies from. How our house authority is working. We have a COVID response page on our website, like most housing authorities probably do, and everything that's happening related to COVID, all the resources in the community, all the changes that we've made as an organization is on that website, so that community members, friends, everybody can stay informed of what's happening. And I'm just thankful that, we have organizations like FADA that take the lead and really work for the benefit of our organizations on the ground, where the rubber meets the road at. And if it wasn't for FADA, in some areas, we'll be lost in terms of how to utilize these funds and how to ensure that our community members are safe. One thing that's important also, and I think, I know FADA's taking the lead at this, we see that the housing authority directors are essential workers. We see that we have the ability, and we understand how to keep our business running in a perfect world, but not only during this pandemic. And so as we continually work toward, dealing with the most vulnerable, we got to think and talk to our elected officials about how, 39 move to work agencies with flexibilities, more agencies need to come around and have these flexibilities. Some of this red tape that they freed up for us now, they need to loosen that up so that we can do better in terms of serving our communities. Every community is unique, and our community is not different. So we have to deal with the clients that's here in Champaign County first. And, the clients in DC are clients, but they may be a little different in terms of their needs. So having that local flexibility, having those waivers that HUD provided, and an additional funding has really been able to allow us to keep our clients safe, and also to move our agency in the right direction. As I said before, we're moved to work agency. And so we already had some flexibilities, and working with my board members, that's been great. We've had our board meetings on Zoom. In order to get those waivers across, we had our board approve the flexibility for the agency to have all our waivers that we want to have, and we slowly start implementing them based on needs. That was one thing that I thought that was really important. When HUD came out with that, we had them, in terms of our board members, approve it, understanding that we walk through it. And so, but before we make any changes, before we make any, real policy changes, we consult all our board members. we've had a meeting every month, but 1 month so far, we decided not to have a meeting. As far as the differential pay, you know, the board approved that. The board approved every activity that we've had in terms of making sure that our clients are safe. We've even paid for some of the staff members' houses to be clean when it was a possible, you know, contact with somebody that was in COVID, or one of our staff members ended up getting bed bugs. And so we want to make sure, you know, I'll always say our staff members are our most important and most valued resources, because if we didn't have our staff, we wouldn't be able to serve the clients that we serve. And so we want to make sure they're safe. So helping out with the differential pay. We also did something early on, because we know so many people are being hit hard with family members. You know, the schools closed, and the cost of food is up, utilities are up, and so we allowed our staff members to buy. We allowed them to cash out. We allowed them to cash out some of their PTO. You know, for example, I take care of my mom and she's ill, so it was helpful for me, you know, to help my mother and my sister, because my sister's husband, you know, his job was like closed down. So I cashed out some of my PTO in order to help my family members, and I think our staff appreciated that. The ones that needed it, they was able to, you know, have a little extra support and not have to worry about it. And so, and you know, when I talk to my board members, I explain to them that, you know, it's a liability. So if I come in here, if I start at the housing authority making $50 an hour and I end up making $100 an hour, that's the cost of the housing authority. So allowing them to cash it out now versus saving it for years and years and years, so they can need it when they need it right now, that was really helpful for our finances long term. And so we have to always think about things like that. But having that board support, that community support, has been great. As far as terminations, we haven't really been terminating clients. I'm really concerned about the rent. You know, I think that's the big crisis that's coming on us. In Illinois, we decided that we had to, we stopped evicting people during the winter, because, you know, we have really rough winters here. And so right after that policy timeframe of eviction stopped, COVID started. And so some people may have and may not have paid rent, or, you know, some people that's trying to take advantage of the system may not have paid rent since November here in Illinois in some of our areas, because of we stopped evictions in the winter and then COVID happened. So we're really concerned about our clients now as we, you know, move back into trying to collect rent. It's been great. When I look at our records, our clients have been paying rent, especially our seniors been doing a great job. So I don't see a whole lot of that, but I do feel it will be some issues related to the rental issue throughout the nation, not just here, but throughout the nation. So we need to really prepare for that. You know, I'm not sure if there's anything else that I really want to talk about at this point, but I know there'll be some questions later. But I just want to, you know, just ensure other directors out there, other staff members and people that's on the line, that utilize your elected officials, utilize your community resources, and don't try to do it all yourself. You know, we have to work together in order to make this work, and share the wealth. Go to our page, you can see the things that we're doing. We're staying informed. The app I told you about, it was one of the you know, new housing authority directors down in Alabama, Albany, Alabama. He had the app created that's really helping his clients, and we're copying that too. So we want to be able to, I don't want to say steal, but borrow from each other, and so that we can utilize the right resources and the right technologies to help our clients long term. And so I'll pass it over to John. I know he got to add some also.
Okay. Oh, thanks, David. Excuse me. Good morning and good afternoon to everybody, because we have East and West Coast. Thank you for attending this session, and thank you to FADA for asking me to participate. I hope you and your communities are safe, healthy, and engaged. Bayonne is in New Jersey, located right across from Manhattan's and attached to Staten Island by a bridge. So we're definitely in the epicenter of what's going on. We're basically an additional borough of New York City. So we had to take measures long before a lot of folks did. When we found out how much money we were getting, which we're a small, large agency, it was a relatively large sum. So we were able to figure out the universe which we were working in. As Crystal mentioned earlier, we decided that our goals were to how to keep the tenants safe, how to keep the staff safe, how to continue business, and then everything else. So we had the top three, and then we're going to filter down. These are not absolute areas either, so they overlap, and nothing's set in stone. You have to be fluid and flexible in these situations. Our first mission was to clean and protect. And I would like to add for housing authorities, please realize you might not be the front lines. You're not doctors and nurses in medical facilities. You're in front of the front lines. If we do our jobs correctly and we keep, especially in our senior populations, we keep the buildings clean. We help folks out so they don't have to have social contact. We help try to eliminate anything like extra cleaning in elevators. We're actually helping our front lines because we're keeping people out of the system. Not only keeping them healthy, but then we're helping the community because there's not that extra stress. And I just like to stress that that is something we're all doing, and please continue to do it and realize and recognize what you are actually doing. So we were fortunate when we started this to have a lot of sanitizing cleaner on hand, but a very limited amount of masks and gloves. And this was important because the city told us right out through emergency management, you're on your own, that we were not going to be, they were not doing anything or had no facility to help us with supplies. So after our first meeting, which was in January, I was on the phone with my maintenance staff on the car on the way back to the office, telling them to get on whatever website or call whatever vendor they knew to try and get supplies in that we're going to need. And this is really where some of your previous work and now also continuing, when you put the right people in the right places, they have done their job over the years. So they were able then to go and foster the relationship with these contacts that now helped us out. We came perilously close to running out of things, but we actually never did. So, and I give them all the credit for that. Concerning this activity, in relation to the CARES, this was obviously, as I said early, so it was before the CARES Act took effect. So what we tried to do was, and I will just caveat that a lot of these things, you should make sure you make a decision on your own or legal or check with the HUD field office. That although some of these things or a lot of these things were ordered before that March date, they came in afterwards. And if we paid for it after that date, we definitely assigned it to the CARES money. Then there's a question if you want to do anything that you ordered it before. That's a little bit of a gray area that I've been seeing. You get a little bit of different answers sometimes when you talk to either a field office or you hear one of the big DC calls that, like, you know, Hunter Hearst hosts or something along those lines. And on a quick side note, in relation to any of those funds that we are not going to have as eligible for CARES money, we're opening up a FEMA claim. Now that's usually a 75-25 split for their eligible items, but it's something to look at. The only thing you have to be careful of is that you don't double dip. Put in the same item for the CARES Act and for the FEMA. But look into that. The FEMA stuff is administered by your state, so things may be a little different from state to state. An obvious use for the funds was maintenance up and above normal. We had staff starting early, staying late, working weekends. Anything we did during the day that could be COVID related and took away from our regular work, we would assign salaries for the time it took to catch up, even if it was on the weekend or after hours. So for example, we had some of our garbage crew that was stationed at the laundry rooms in senior buildings, and we monitored or controlled the flow of traffic in and out. But after each person was in there, we went in and sanitized whatever machine they were using before we let someone else in. That took away from them doing their regular work during the day. So when they worked overtime at night or on the weekends to catch up on things, and it was literally a daily occurrence because garbage does pile up on a daily basis, we're assigning that to, to the CARES funds. Also be reminded that if you have to set up your staff at home, which obviously almost everybody has, you look at the cost of laptops, cell phones, printers, ink, other office supplies. If you're sending out any mailings, the paper envelopes and postage, you know, that if it relates to the COVID, letting them know what your new office procedures are, what to do about rent, things of that nature, charge that off also to the CARES money. There's also a second phase to this, and that's reopening. Up here, I don't think I'm even going to be looking at getting close to anything here until after Labor Day. Even though we're one of the downtrending states, we're still in the top 10 in a lot of areas. So I'm being extremely careful with this because I think it's the most prudent thing to do. So for maintenance, we're aiming for a 6-month supply of PPE including masks, suits, gloves, shields, as well as cleansers, paper towels, etc. The reason I'm going for 6 months is based on that first couple of months that we had to deal with. We're still getting orders in that we ordered back in January or February. If something breaks out again and you see all the upticks, we don't know how bad this is going to get and where the supplies are going to go. And if they're coming in from another side of the country, are they going to be diverted there? A lot of the stuff actually we wound up ordering off Amazon, wound up coming in from China. You don't know. So you want to get your hands on what you can, because I don't want to, when I reopen, interrupt service or get back to normal with work orders, for example. We're still only doing the emergency work orders, but when we can fit in other things when we're in an apartment, we do it. Also, PPP for the office, including a supply for whatever appointments when we start having folks back in the office. We're not going to do walk-ins. It's only going to be by appointment only, but we're not going to see anybody if they're not wearing a mask. So we'll have a supply for folks if they don't have it, or even if they just want one. Don't have a problem with that. We're also in the process of installing plexiglass dividers at our workstations. There's enough distance between them probably, but you're going to be sitting there all day. I just feel more comfortable for workers, as they do. I have to take their feelings, their concerns into consideration, as well as what we're projecting is the best case scenario. As I said, we're only going to be doing office appointments only, and we're going to convert our lobby into some mini meeting rooms, at least 2, maybe 3, that can easily be disinfected after every use, and then have laptops or iPads in those rooms to be able to communicate with people at a distance, but still live and in person. We're looking, and we have instituted electronic signatures for forms. That has worked out very well. We're looking at computer upgrades that allow for online applications and status inquiries. Currently, we don't have that. We're looking at setting up direct deposit for the rent, staggering our hours or increasing hours, just to keep in mind that they could be union issues and there may be pay scale issues or differential issues. So that may be a use for some of the CARES money. Also, we're looking at getting kiosks for the lobbies also. So when it comes to applications, applicants and or recertifications, folks may have the ability to scan in material straight into our system. Once again, cutting down on the contact that we'll have to have. Looking out for the residents as well, and applicants and participants as well as our workers. One thing we are in the process of putting in is thermal time clocks. They will not log someone in unless they pass a temperature gauge, of which they set at 100.4. Kind of takes your picture. Not sure we're going to try and do that with our applicants and participants coming in, because we don't know yet. We're looking into it if there's any legal restrictions on just kind of doing it to the general public. Employees might be different, but we're just following up on that. We think we should be okay with that. Also, iPads for our inspections when we start that back up for our inspectors, but also being able to tap into those of our residents and participants that either have their own capacity or through the phones or iPads. And just on a side note, David mentioned something about closing them to a certain degree, but also whatever restrooms we'll have open in the office, switching over to hands-free faucets and toilets and everything. Try to make it as safe as possible. Some other topics just to cover with the money to look at is the potential of replacing lost income with CARES money. That we haven't done our total analysis on that yet, but honestly, the way I look at it is a lot of the folks in our program are actually probably a little better off than the general public in one regard, in that we base our rent on income. So if their income change and it goes down, their rent will go down. If they provide to us that they're in New Jersey had a horrible problem being way behind in unemployment, show us that you applied. Okay, we'll freeze everything. And I was just very happy today. I had an email about 10 minutes before we started. A resident emailed in saying that she got her notice that she's back to work and she got her retro check and she wanted to come in and make sure her rent was adjusted appropriately. Couldn't have been happier to hear that from someone who did it on her own without us asking. Something else to look at is whatever phase you're in, for paying for salaries for high-risk employees to work from home, to see, because there's some folks that they really should not be in the office because they should not be in contact with anybody. I have seen on the questions and at some presentations that if there's a need for a COVID-related vehicle. One thing that I latched onto early was, remember that food cannot be purchased with CARES Act money. I found this very frustrating because one of our goals was to try and keep our seniors in their apartments as much as possible. If they have to go out to get food, they're going in an elevator, they're waiting in the lobby for the bus that comes by, because unfortunately we don't have any supermarkets within walking distance. So I looked into that very early, and you cannot do that. We fortunately had some donations and worked it out. But the analogy I use is, so someone can donate us a can of soup, and we can hire someone to heat that can of soup up for someone. But the money we spent to hire someone cannot be spent on buying 5 more cans of soup to keep that person good for the week. It's a little frustrating, but it's the way things are. My 2 ideas on that are that if you have CARES money that you're drawing down and is put into operating, as I understand it, the restrictions are then gone. So if you had other money that you wanted to use that was non-CARES, or it becomes non-CARES money, you can. And also, as I mentioned before, the FEMA. I did confirm with FEMA that providing food is an eligible expense. And it is a 75-25 split, so you have to pay 25% of what it is, but it's still better than not being able to provide at all. Also, I've heard conflicting things on this, so if any of the other panelists at some point want to jump in on this, in relation to an expenditure versus an obligation date, I have heard both things, where it's okay if you obligate before December 30th and then either the service or the product doesn't come in till afterwards, that's when you would pay for it. And I've heard the flip side, that if you're not putting that money out by December 31st, it's gone. So I don't really know specifically on that one. That might be a good thing for folks just to know if someone has better information than me. And also, I just wanted to say, because we've had this question in New Jersey, and our directors, we've spoken a little bit. So probably the top 3 places we've been getting supplies from of varying nature are Amazon, HD Supply, Staples, and then our local vendors. And once again, the local vendors, even if it's like a Lowe's or a Staples, I know they're not a quote local vendor in the sense of a mom and pop type organization. But if you've gotten to know the managers over there over the years, that goes back to where I talked about your folks having a good relationship. We fostered some good relationships with like a local Lowe's. So they know what we need and what we'll buy. They will contact us sometimes when things are in place. I mean, there's a lot here for everybody to be doing. Be creative. Definitely think outside the box, as David mentioned earlier. And the only caveat I put out there is, although the public housing program does have a lot of latitude on what you can do, just make sure that you cover yourselves. A lot of documentation. We're going under our ARA standards from years ago for the recovery. That's the standard we're using for documentation. So we kind of had it in place. And I just hope, as I think there's been some communication, that these waivers get extended so we can plan and not have to just turn the spigot off on July 31st. And I'll turn it back to Seth then. Thank you.
Thanks, John. Before we go into our structured Q&A, I will just read something briefly from the PIH notes on supplemental operating funds, which talks about the question that John posed about obligate versus expenditure for the CARES Act funds. And so what HUD says is that the period that the period of availability for funding, and not only for the funding, but for all the waivers, is the period during which the program is impacted by coronavirus, and HUD is initially defining the time period as through December 31. So as of right now, HUD says they'll issue additional guidance if the time period that the funds can use will be extended, but up until December 31 is what they're calling the period of performance. And so if the funds, our understanding is that the funds aren't expended by that date, then they'll be, and there's no extension by HUD, then they'll be recaptured Um, they haven't put out exactly their guidance in the process for that, but that's what the documentation that they have out so far speaks to. And so we'll have a few, and I see we've been getting some Q&A, and some of the panelists and staff have been responding, and so that's good. And so keep those coming, and we'll address some live. But to start the conversation, John, you talked a couple of times about having people in the right place. And so, one of the things that I've been thinking about is an agency's ability to effectively not only use the funds, but effectively have kind of infrastructure in place. And you talked about relationships and things of that nature. What would you recommend for an agency that's looking to have that in place in advance of, I know where, the ball game, so to speak, is already going on, but for an agency that might not have had all those things in place, would you be able to identify anything that they can do now to get to where you were in terms of having the relationships and the people in place to handle the additional funds and the needs?
Well, it's never too late to start, number one. And we had a little bit of fire drill with this, if you want to call it too, because we were affected by the hurricane a few years ago. So that also helped it. Out of tragedy kind of came a little bit of benefit at the end. But there's nothing wrong with this point, even going today. Why not start today? Because this is not going away. Until there's some sort of a vaccine that is effective, we're going to be going through this. It's spiking. We went through what we did and we're kind of leveling off. It's still high, but now we're looking at the rest of the country. So make that inroads now. Find out who the manager is at your local, your local Lowe's or your local hardware store that's privately owned. Call HD Supply or one of these other places and get a salesman that you can find out you can work with. And that will be the one person that you kind of are specifically in contact with, and just foster that relationship. The other thing that I know sometimes is a little difficult, and we're government, so it's a little bit of a pain, depending on your situation and what your board will give you deference to do. Sometimes vendors don't want to wait to be paid. If you just missed a meeting yesterday, another 30 days, they may want something. If your board gives you that latitude to, cut a check or something that they'll ratify, that's something that helps too. Cash is king, although in this case it would be a check, but still same concept.
Thanks. And I think that's really important because, as David, you talked about a current kind of second wave in Illinois and where you are. And so it's important for I think for agencies to remember that regardless of kind of the position that they were in when this happened in their community, like you said, John, it's never too late to start, to prepare and to build the infrastructure that you need to sustain and to maintain your operations. So you guys have talked about, and we just mentioned the second wave, but aside from the threat of additional COVID cases in your community, and we'll start with David with this question. I'm wondering if you foresee any adverse impacts to your programs in the future. And also you talked about a lot of development going on. And so are you starting to see any ripples in your development as well?
Well, I'm glad you brought that up, especially with the developments. As I said before, we're doing a number of panel discussions, and we had some developers on last Friday, and we talked about the effects of COVID and the civil unrest related to our 4% and 9% developments. And we've had effects, especially when we talk about lease up. We want to bring, when you're doing a tax credit project, you have a certain time frame where you got to have your, delivered in terms of lease ups. And so we've had difficulties with that. A lot of people's not working now. So the rules related to, whether it's criminal background checks or the levels of income, it's hard to prove their income now. A lot of people's out of work. And so we've had a lot of challenges with that. So we're working with, the state at the state level to try to figure out what we can do to continue. We have to reopen. We just opened a new waiting list now because we went through the waiting list so fast for one of our new developments that we have because of that particular reason. With the spike happening right here, we've had a lot of protests and things going on here locally. Like I said before, I was hit hard personally with it. So we're looking at the effects that's going to happen, in the next month or so. We originally planned to open back up and start dealing with clients and bring everybody in when, probably in July. But since what's happening now, we still don't have a vaccine, and so we're pushing that back. We're trying to eliminate the person-to-person contact as much as possible. I know some people had asked questions about how do we determine the differential pay. So we know our maintenance and our property managers, they've been on the front lines continuously from the beginning, right? So we did a monthly salary. We based it 10% of their monthly salary. So they got that. So they get that at the beginning or the end of the month, just out, off the top. And for our other staff members, if they have to come in, like our leadership team members that still work in accounting, people like that that's in the office constantly, we're giving them 8%. We felt that the maintenance staff and the managers, they're in harm's way all the time. We have to have them on site. So we just wanted to make sure that we was providing something to show that we appreciated them and give them that additional motivation. We've had a number of people resign. Some of our elderly staff that was not well said, when we talked about coming back, they said, I'm just going to leave and retire now instead of having to deal with that. So we've had to deal with trying to replace people now, right, in terms of that. So we're trying to hire, we're trying to reorganize. I'm doing a real crisis. So I think the effects will be real as we continually deal with what's occurring right now.
Could I just add something to that? To keep an eye out, and once again, it's going to be an individual decision on your authority, I think, but in discussions I've had generically with other directors, the concept of hazard pay has to be, you have to examine that. Quote, the word hazard may expose you to other liabilities insurance-wise, so you have to make sure you're not backing yourself into a corner. So you might have to check with, in New Jersey, we have a JIFS or a joint insurance fund, your insurance agent or your attorney or something. I would recommend that if you either maybe call it something else, whatever, but hazard does have certain connotations and you just have to keep that in mind.
That's why we called it differential pay, so that we wouldn't get caught up in that hazard pay type situation.
Thanks. And, pay for employees has been a question that we're getting constantly, because just like you said, employees are on the front lines. Employees are dealing with the same things that our residents are dealing with. It might be that the school is closed, or the childcare center is closed, or they have the same issues getting cleaning supplies and food and things like that we're talking about. And so, like David said, it's impossible to serve your residents if your staff aren't in a position to work effectively. So that's something that's definitely in the mind of a lot of executive directors. I know we haven't really talked specifically about programs, but John, I'm just curious briefly. I know you have a smaller voucher program, but I'm just wondering if you've noticed significant issues in your voucher program, given your proximity to really like the epicenter, one of the epicenters of COVID in the country, and what that has done in the rental market.
Well, the biggest thing we've seen, obviously, is with the loss of jobs that our HAP payments have gone up tremendously, and we have to keep an eye on that. In relation, we're kind of on lockdown, although it's loosening up now, so that basically wasn't an issue. Everybody was locked up. But one of my concerns that hasn't materialized yet, but I am worried about it, is that we have folks in multifamily units, whether it's 4, whether it's 12, whether it's more than that. And if the landlord may be getting our money, but if they're not getting the money from the other residents because they lost their jobs and things, I'm concerned about the quality of the buildings. Eventually, if we get to HQS issues as we move further down the road, or if things start going in foreclosure, what does that mean for our participants?
Thanks. Those are really good points as we think about coming away from some of the waivers, like you talked about inspections. So obviously there's an HQS waiver. The question that you had about the availability of funds. One of the things that everyone listening should know is that FADA is strongly pushing for an extension of all of the applicable waivers and additional waivers for public housing and voucher program, and to push back the deadline for the use of funds. And those we think are really important to provide some level of certainty and comfort for the industry so that you can plan long term rather than trying to figure out how to continue to serve your population, deal with the changing effects of the virus in your community, reopening, and a kind of a mountain of work coming at the end of the year as the waivers go away. So that's something we're working very hard on. Both of you have talked about addressing the needs, identifying the needs of your community. And David, you specifically talked about addressing homelessness and the preference that you gave for homeless individuals. And so if you could start, David, by talking about how you've worked with your community partners to identify needs in the community and address any of those.
Okay. Well, I think that's important. Whenever, first of all, as a local housing authority, as I mentioned earlier, we deal with some of the similar clients, whether it's, with the criminal justice system, whether it's the hospitals, various programs. So, we're engaged tremendously with that. And so we've had an emergency response team dealing with the COVID since March. And the Housing Authority has been a part of that team, and I was the representative for the Housing Authority. And so as far as the local service providers, we also have a weekly call where we talk about issues that we're having, things that we need. For example, we had a food processing plant where, it had close to like 300 workers. A lot of them was immigrants, and close to 50% of them tested positive for COVID. And so, the call came, we had new developments going on. So I got a call, hey, Bristol is just now leasing up. There's a lot of vacancies out there. Can you house some of these clients? Because we found out that a lot of them living together. They're working 2 and 3 jobs. So not only are they working at the food processing plant, but their family members is living with them, working at the McDonald's and working at the grocery store. And so we're passing this, COVID is just going rapid. And so when we talked about it, I said, I can't really put people in those type of developments, and I don't have vacancies like that. And so we suggested that they, commandeer one of the closed hotels and put people there so we can have an epic center in terms of testing and making sure people are safe. But when you have a whole lot of people living together, so just utilizing our community resources, we came up with it. And like I mentioned earlier, the preference to COVID-19 stay-at-home voucher. We found that, the shelters were like slammed, it was packed. So we wanted to, one, make sure that people got out the shelter, but also they got into housing and remain safe. So we required that if a shelter was part of our continuum of care, and somebody was in a shelter for at least 2 weeks, the shelter had to continually provide services for them, right? And so we gave them a voucher right away. Again, we set aside 50 vouchers. Project-based units for that, just utilizing the resources. So we, as a community, we try to come up with every win that we could have to help people safely in this community.
And John, do you want to talk briefly about how you work with some community partners or local governments, or kind of what that's like in your community? You mentioned the meeting that you had kind of back in January where local government kind of said you're on your own. So do you want to talk any more about that?
Sure, no problem. Yeah, that happened just in the sense of it was emergency management, and we were all trying to find our way. So in a way, it was not a good situation, but I appreciated knowing it so early on. I didn't find out at the last minute. But probably the tightest thing that we've done, the 2 tightest things that we've done, is through some community organizations, then taken over by a community food bank that the city started, and the residents started contributing food. We probably there's been a little bit of a glitch in it now, but over the course of this, we've given out over 5,500 to 6,000 meals to our senior citizen residents. We're very proud of that. And once again, that had to be donations. The other thing that was very effective, the local medical center recognized our senior population in a congregate setting, condensed setting, to be high risk. So they tested everybody for free if they wanted to. We let them come in the communities rooms, and we wound up getting just about 50% of the people came down out of the buildings that we have. And then we think there's probably another 10 to 20% that got tested on their own. So we got a nice coverage on that. Those were our 2 main areas that we interacted.
Good, thanks. So when you talk specifically about funding, I think you both laid out your kind of priorities very well. But I see there was a question in the Q&A about spending money now on maybe a large purchase or a service for residents that you cannot maintain or that you may not be able to maintain under normal budgetary situations. And so we've got a lot of questions about purchasing vehicles and things of that nature, whereas agencies weren't able to do that before. But so how would you advise an agency to think about purchases that they're making or ways where they're putting funding that their normal budget might not support, but they're items that have been needed or are greatly needed for this moment?
Well, I could start, and I just suggest that, you think it through. Don't think it through when you're making large purchases. As you said before, you have to maintain it. Try not to do things that you won't be able to maintain, because it makes you look bad as an organization, and eventually it hurts and harms you in terms of your clients. If you're doing things, and I know it's hard to try to plan when you're going through a crisis, but it's really important. And that's why, these panels and sharing information around the country is very helpful. So we haven't made any large purchases. The largest purchases that we made in terms of preparation for reopening, we have items coming in, different desks, computers. I bought additional cell phones for my staff members because some people were at home. I know somebody had asked about utilizing some of the money for Wi-Fi. We had to make sure our staff members was equipped, so we bought Verizon hotspots and things like that. We paid each staff person for their personal cell phone and their utilities at home, $25. If you didn't have a company phone and things like that, we gave them $25 a month to help with those costs, because they are using their own utilities. They are using, maybe their personal cell phones to check on clients, because, some of the staff that, other than maintenance and management, that may not be considered essential, we have them doing a phone tree where they're calling clients and checking on them if they have needs. We cashed in our points on our credit cards and got gift cards. And when we found individuals that was, really in need, we provided gift cards to them. We really didn't have to buy food. We partnered with community partners to provide food for us to give to our clients. And so, it's just been great. So we haven't, our large purchases we haven't bought vehicles. As I mentioned earlier, we 100% RAD. And so either all our developments have been rehabbed or they're brand new right now. So it's fortunately that we're already equipped with a lot of the safety mechanisms, and the latest items. A lot of the items that we are purchasing, like I mentioned earlier, our desks, computers, screens, things like that, and supplies, so we can make sure that when we do open we can do it safely. We've provided all our staff members with at least 8 masks, reusable masks, so they could wash them and clean them. So we're just maintaining right now. So we haven't had to really spend a whole lot of money on large purchases. The biggest bulk of the money has been on the amount of stuff we have to provide for our clients and the safety of our staff members.
And I would just say, when you're planning things, include viability in the analysis of whether you're going to do it or not. Some large purchases, if it's something that's going to last 20 years, fine. If it's something that requires a monthly fee and you're not going to be able to handle it, you have to weigh that in. And the other thing I'm going to say is, attend things like you're doing right now, because about half the ideas that I mentioned, stuff I got from talking to other directors, are being on these type of calls. So I get a lot of information out of and ideas, and then you change them and adapt them to yourself.
Exactly.
So John, you talked about being flexible and fluid. And so one of the things I'm wondering about, and you've talked about your priorities, residents, staff, and getting back to business, but how difficult is it, and what methods do you use, aside from talking to other EDs and participating in webinars like this, to really anticipate the challenges that residents and staff have, and to best serve those communities, your communities, during this time and looking to the future?
Well, we started off with kind of in relation to, let's say, the office running and things. We're on a limited capacity. We're not doing move-in yet and things of that nature. But finding out, one of the first things we did was, for example, notify the residents, if you lost your job, let us know. And after that started coming in, you have to rely on your senior staff and sit with them and get the ideas and let them tell you where the strengths are, where the weaknesses are, and work with them as a result of what they're hearing and seeing from the residents, participants, and workers, and kind of go from there. In relation to the community, for example, when we had to deal with the food issue, as things ramped up around here when we got into April, and there's lines at the local supermarket, literally when they first instituted that, when things got bad, it was over a block long. I mean, our seniors, even if they could get there, we're not going to stand on line in the rain for 2, 3, 4 hours, whatever it was. So we had to adapt somehow to try to help them out. Same thing with when it came to cleaning. You do the extra cleaning when you know there's more people coming in between 12 and 2, because that's when they get their visiting nurses or something like that. So that's where the flexibility comes in. Eye your situation, and then just keep on top of it.
David?
Same thing. When we talked about, how do we make some decisions, whether it's the larger purchase or just really thinking through it. Our leadership team members, we met constantly. And then also I met with my overall staff members on Zoom constantly to get ideas so they can provide it. We don't know everything, it's still new. And so, even though we're executive directors or leaders of our organization, we sometimes don't know how or where the rubber meets the road at. And so we needed our maintenance staff members, we needed our property managers, we needed our voucher staff members to tell us what they need, right? So we, in order to make their job effective, right? And like we talked about Zoom now, I like the virtual briefings. We've been able to continually lease up, and we tried to focus on what helps and hurts the organization. Lease up is important, so let's focus on things that we can do right now in order to make our organization better in the long term and help people. So we looked at wins. So our leadership team members came up with what wins that we can provide, and we listen. We listen to all our staff members, we listen to our community partners, and so every time we made a decision, we made an effective decision, whether it was, like I said before, differential pay or additional laptops. I know a lot of agencies has been doing a whole lot, and so I've searched the website and talked with a lot of directors about things that they may be doing, so we can borrow from that and utilize, reinvent the wheel, right? You partner and just use some of the same resources that others have already used, and so that's just important. But you got to make sure that you also keep your board members engaged, and it's hard. We have 7 board members. It's hard to get in touch with all of them. So I really focus on focusing on my board leadership, my board chairman, and along with my board vice chair. I talk to them constantly on a weekly basis, and then I send notes out to the other board members independently. Most of you guys, the governor passed the Open Meetings Act where we can host meetings on Zoom and things like that. But that's been very helpful for us. But please stay in contact with your board members, because that's one of the biggest things. They need to know what's going on. A lot of times they give you that flexibility to utilize your resources in the right way, but you just need to make sure they stay engaged and know what's happening.
So I'm going to ask one of the questions that we got in through the Q&A. But before I do want to remind everyone that as we're discussing these kind of eligible costs and getting into that, there are going to be 2 things to remember. One, there are different rules for public housing supplemental operating funds and the supplemental administrative funds for the voucher program. So in the voucher program, remember that in the PIH notice, and there's a document on the HUD HCV website that lists the eligible expenses for COVID response. And so for admin fees, you can use supplemental admin fees for any pre-existing eligible admin fee use, in addition to the specific eligible uses outlined in the PIH notice and in the document that HUD maintains. On the public housing side, you can use your additional operating subsidy for, again, any routine operating expense or capital expense, in addition to any of the identified eligible uses in the notice and other reasonable expenses that you determine at your agency. And so with that said, there's a question about using CARES Act funds for toiletries. And I'm wondering, you guys have talked about food delivery, you've talked about some gift cards, but have you gotten into specific items like that, toiletries? for your residents?
We haven't. We've had a tremendous amount of support from, like I mentioned earlier, local hospitals, the universities, individuals that has not been utilizing some of the stored resources for whatever reason. We have a big 10 universities, so they have a lot of that. So they've been able to reach out and help us in that way and help our clients. So we've really been, providing items for our clients. For example, I mentioned earlier, like making sure our staff members are safe. All our staff members, and we provided everybody with Lysol, with hand sanitizers. And so some of the donations that we have, we provided for the clients also. So we boxes and boxes of hand sanitizer. We try to eliminate, like for one use we did, the elevators, right? A lot of times you look at your elevators, depending on the type of, walls you have in your elevator, some are easily sanitized and some aren't. So when you talk about making some decisions and spending money, look at items like that. That's a win for you. Not only are you repairing something that may need to be repaired, but also it's safe, it's user friendly in terms of sanitizing and cleaning. But it adds value to your to the life of, I guess, the elevator and things like that. So that's what we've tried to do, that not just focus on what we need today to stay safe, but also what we need today, but also long-term it'll benefit the organization. So use your money appropriately to help the organization today, but into the future.
John, any comment on toiletries?
That was a little bit beyond our capacity. We wound up focusing on the food, and it just, there were limits to what we could do. So we didn't get to that.
Okay. There's a good question here about using funds for multifamily housing. And so I will say that with the exception of the operating subsidy, which can be used for your capital expenses in the public housing program, those dollars for each program are only for that program. So you cannot use public housing funds for multifamily properties expenses. Same with HCV funds couldn't be used for multifamily properties. I'll pose a question, John and David. Is it okay to use it for administrative costs if we are still being impacted by Corona? For example, our Section 8 staff is not meeting families in person. And so I think, I'm not sure, Oscar, if I get this wrong, please clarify, but if there's been, I don't know what you guys did in terms, I know you talked about having people work from home and essential people coming into the office, but have you had issues with decreased workloads for staff, or were there a time maybe where your maintenance staff weren't working at all? So how did you handle having staff paid that may not have been performing their normal workload, or may not have been able to work at all if you didn't have telework at some point?
Well, one of the things that, in discussion with my board members, again, I'm a big staff asset type person in a sense. And so if we couldn't provide the right atmosphere for them to work, we had them use, they did something, right? They made calls, they checked on clients, they called vendors for us, right? So we know that everybody, I'm on my second 14-day confinement, and so since I'm a single dad and I'm caring for my kids, when they came back, I've been in the house for a whole month now. They came back June 1st, so I haven't been able to use none of the COVID PTO or anything like that. Even though I've had symptoms before and stuff, I still had to work. And so really the flexibilities that the board has given us, this is what I'm essential. This is my role. So it's not a problem, but my staff members, I don't want to hurt and harm anybody because of this epidemic, and that we don't have the ability to help them work or have something for them to do. So I haven't laid anybody off. We still pay them. Some people probably put in 100 hours every 2 weeks, and some people probably put in 14 hours, but we paid the people because it's not something that we cause or they cause. So we want to make sure people remain, active and engaged in what we're doing. And when we find something for them to do, we provide it for them, to do.
In our maintenance that we worked, we didn't, except for we had a few cases of that they had to go on isolation, but we pretty much assigned someone to a site, and that's where they stayed. They didn't clock in the normal way. We went and checked to make sure they were there. This way, if they went down, then there wasn't cross contamination, so to speak. We kept people working by themselves. In relation to the office, it's kind of been a come in as needed with the permission or guidance of your supervisor. So there's not just coming in for no reason. I am the worst one with that, though, because I pretty much I think I missed one day since this, because I locked myself in the corner of my office. I'm 5 minutes from the office. But I feel more comfortable and work better that way and think I need to be seen to be around. One other thing I'd just like to add in relation to, and I have not looked at it yet, but one of the Jersey directors sent out an email with a link to, I don't even know if it's a program or it's some sort of app that you can monitor the work productivity or time online with your, like we issued laptops to our folks that are working at home. You can monitor how much they're working or their online things. We're looking into that. That may be something that you want to look at if you're having an issue with any productivity or have any question.
You know what, the university has that software here, and we had thought about that. But again, with all what's going on, you have to focus your energy. And, we want to focus, we'll deal with that later, in terms of that. So we didn't want to focus energy on that right now.
I was just going to say, our problem actually is with a couple of people. It's the opposite, that we're finding out because they're sending emails out at 2, 3, 4 in the morning. It's like, you're going to burn yourself out. So, so, okay, you, but.
So you guys have, you've detailed all the ways you want to spend your funds. And so you've talked about essentially, what I take away from what you talked about is you have enough ways to use the funding that you're not running into an issue. One thing I've heard from small agencies, and Crystal, I'm not sure if you've heard this as well, but some level of concern about being able to spend all of the funds. Crystal, can you, if you have heard that, can you kind of explain why people are asking that question and what advice you would give to avoid being in that situation?
Yep. So I think we heard it primarily more often in the beginning, probably late March, early April. And I think that, given the history of inadequate funding, that agencies aren't used to just being given this money that they then should, I would say, spend right away, except possibly during Oughta back in, I think, 2007. So I think in the beginning, there was some concern about how do I spend it quickly and correctly so that I don't then get audited by HUD in the future and have possibly done something wrong. So I think that there was some fear on spending it the right way. And that is essentially why I think this came to be. And then some of our articles in the Advocate, really getting food for thought for agencies to become, I think originally it was becoming creative, but now that it's for any eligible expense, I think that particularly for small agencies that probably received a lot less funds than maybe John and David did, really spending it on your normal, how to maintain your normal operations. And then if there are other ways, innovative ways that you could support your communities, use those funds from, other non-supplemental appropriations dollars. And I do think that the FAQs and the PIH notices do have lots of really great examples in addition to the excellent examples that we've gotten from our not residents, but from all the executive directors. Right. And like John and David said, it's really important to get on these calls and read our articles and really interact with your other executive directors in your local areas and also listen to your staff, like David said. And I think the agencies that I've spoke to that are as very successful spending this money are the ones that are communicating to their board, to their staff, to their residents, and then even just getting that information out, keeping people informed so that they can adjust as needed. So I hope that answered your question.
Something to that, I was shocked and taken back. When we think about, we're public housing authorities, right? And the mindset that we have is, about obtaining resources that's non-federal. When the first monies came out, we're 100% RAD. So we don't have no public housing. So we didn't get any funding on the public housing side for that. So it was like a shock when everybody, all my colleagues was talking about the money they received. And I'm like, well, we didn't get any of that, you know, because we're RAD. So.
Yeah, that is an important point. And so, you know, one of the things when I asked earlier the question about being ready for an infusion of funds, one of the things that happened this week in Washington was the introduction of a bill to fund the public housing capital needs backlog. And so we've been having conversations about the agencies that have already converted under RAD and wouldn't, you know, be eligible for supplemental funds to take care of their capital needs. And so that is a question. Another thing that has been brought to our attention is that the operating fund subsidy obviously takes into account tenant income. And so if tenant income is a small portion of your operating budget, or if it's a large portion, then that will affect your operating subsidy. And so we had an agency that got a smaller portion relative to other local agencies to them of supplemental operating funds because they don't have a lot of their subsidy formula isn't made up of tenant income. And so they still have all of the costs to cope with coronavirus, but fewer relative dollars than other agencies. So that is something that we've been hearing about. And I do have a question on this topic of RAD, which says, can the HCV funding be used for RAD PPVs in the same manner? The notice says, and this is the PIH notice, says that they can be used for PHA-owned PBV developments. Our development is in year 1 of RAD and still getting funding from LOCKS. Dave, I'm not sure if you've talked about, you've done RAD. I don't know if you have any more recently converted developments that question would apply to.
Well, I did a RAD replacement that I'm leasing up now. It's a 9% deal. So we really haven't, you know, utilized that. It's not all the way done yet. And so I only have 24 units it's 120 units. It's a 3-story, then it's like 20 flats for people with disabilities. And so the flats are finished. And so we haven't had to access any funding for that because it's still under, you know, the new development costs.
Mm-hmm. John?
Sorry, we're not a RAD agency, so can't comment on that.
So, so the notice does say that you can use the admin fee for the phrase, the bullet that they have is procuring cleaning supplies and/or services to maintain safe and sanitary HCV units, including common areas of PHA-owned PBV projects. So that is accurate that you can do that. And you are and we're working with getting some clarification from HUD on the specific issue of the ways that agencies should use supplemental operating subsidy that is for projects that have already converted to RAD, and this, like the question said, that's in their first year. And so those agencies and those projects are still receiving operating and capital funds. And so we are waiting for an answer from HUD, and we'll post that if we get it by the time this Q&A comes out, on exactly how those funds can be used, if they can be rolled into the new project, and what HUD's rules will be about that, because that's a really important question that hasn't been answered in the Q&A. It hasn't been answered in the FAQ or the PIH notice. And so we are approaching the end of the time for the chat. And so we have a comment and not a question left. And so John or David or Crystal, do you feel like we missed anything that you want to mention in the last 45 to 60 seconds?
I just want to add, just continually, you know, focus on your local needs. Take advantage of the flexibilities that HUD is allowing us, but take advantage of them for long-term purposes. So understand, you know, whatever computer softwares, you know, Zoom, all that kind of stuff that we're using, and see how it can affect the agency long-term and be beneficial. I think that's important, especially being an NPW agency. We look at decreasing our administrative costs, but being more productive. And so with some of these uses that we're forced to use now, I think long-term it'll be helpful for us.
And I just want to say something I'm sure everybody on this call doesn't hear enough. Thank you for what you do.
Exactly.
And the last thing I just wanted to say was that many of the questions that we received today are very specific answers in the FAQs and the PIH notices, which I completely understand that that's about 75 pages of reading that you all are very busy and have so many things to do, but reach out to us if you have any additional questions. And the slides have all of the links to those documents if you wanted to take a look. And then I'm not sure, Seth, if you mentioned this, but just a reminder that FADA will push HUD to extend those waivers and also the year-end expenditure dates.
You know, Crystal, you mentioned about the reading. Another piece of software that we utilize, you know, a lot of on our computers now we have dictation where you can just talk into it and it'll type for you. But also I've been really utilizing the read software. So when we have those long notices and you have to multitask, I hit the button, let it read it to me while I'm working on something else. So it's been really helpful. So.
Great. I want to say thanks to the panelists, thanks to all the participants, and I'll turn it back over to Blake.
Thanks, Seth. And so this does conclude FADA's webinar, Putting CARES Act Funding to Work. We would like to thank all of you who attended today for your questions and your time. Again, thanks to our panelists today for sharing some of their own experiences with putting CARES Act funding to work. To reiterate, FADA continues to be in contact with HUD and Congress to advocate for more critical funding. In addition to, has been stated already, that we're pushing to extend the waivers to address housing authorities' concerns for the coming months. FADA has also been working with its leadership and members to ensure that all interests are represented in our work with HUD and Congress. And if there is anything that you feel that is not being addressed, please let us know as soon as possible. Email us at info@fada.org, and we'll make sure to address those concerns in a timely fashion. I'd like to remind everyone that a recording of this webinar will be available shortly on FADA's website. In addition, at the conclusion of this webinar, you will be directed to a brief survey, and we sincerely appreciate your feedback on ways that we can improve future webinars. So thank you again for your time today, and thank you for the hard work that you are doing every day in your community during these difficult times. FADA will continue to keep you informed of the latest industry news online with email alerts, video briefs, and with more webinars in the near future. Thank you very much.